As the gentleman from New York, Mr. Engel, 5 minutes for questions, please.
Thank you, Mr. Chairman. We've heard Republicans describe their alternative picture of Medicaid before. In fact, we've had a hearing on most of these bills before. I don't think anyone here would disagree with meaningful efforts to shrink waiting lists and afford Americans the services they need quickly. But that's not what these bills do. These bills represent yet another Republican attempt to gut Medicaid based on total falsehoods. I think it would be helpful to talk about the real Americans for whom Medicaid is life-saving. First, let's clear up any misconceptions about who Medicaid covers. Nearly a quarter of New Yorkers in my home state were covered by Medicaid or CHIP in 2015. The vast majority of New York's Medicaid beneficiaries come from working families. These Americans cannot afford private health insurance, even with a full-time job. For them, Medicaid is a chance to stay healthy, which means a chance to work longer hours and provide for their families. Now, I'd like to debunk another misconception. My friends on the other side of the aisle allege that Medicaid spending is out of control. In fact, Medicaid spending is lower than the spending growth rate of Medicare and private insurance. And again, I'll point to New York. Despite charges that Medicaid is inflexible, our state has dramatically revamped our program to improve program integrity, better care for patients, and save money. These efforts have avoided costs to the Medicaid program in excess of $1.8 billion. New York achieved this while expanding Medicaid and cutting our uninsured rate in half. There's one more issue I'd like to address, and that is the one before us today. Republicans' ideas to strengthen Medicaid entail delaying or denying coverage to Americans that need it to redirect funds to other parts of the program, specifically to those states that choose to operate waiting lists for Medicaid home and community-based services. They're suggesting that if states have high coverage levels, they're also letting Americans suffer on waiting lists. So let me ask you this, Ms. Solomon. I'm wondering if you can help us delve into that claim. You said in your testimony that 11 states and D.C. do not operate waiting lists. I believe my state of New York is among them. Is that correct?
That's right.
Thank you. As I said a minute ago, New York cut its uninsured rate in half, thanks in part to its decision to expand Medicaid. Now, even with that major expansion of coverage, 0 New Yorkers, nobody, was forced onto a waiting list. So, Ms. Solomon, let me ask you again. Would you say that New York's example is representative of most states without waiting lists?
It is. I mean, as I said, only 2 of the states without waiting lists have not expanded, so there isn't a correlation there.
Thank you. And I have one final question for you, Ms. Solomon. Is there any evidence that refusing or holding up Americans' Medicaid coverage, as these bills would do, would reduce waiting lists for home and community-based services?
I don't think they would, because these are all state choices. States have made a choice whether or not to lower their waiting list, to provide more services, to take up options. It's all state choices. It's not necessarily because another state has done something for other people.
Thank you very much. Now, let me say that if, as this hearing title suggests, my Republican friends are serious about strengthening Medicaid, and I quoted, this is what this is about, strengthening Medicaid and prioritizing the most vulnerable, unquote. Well, let me suggest that there's a way to do that. The Affordable Care Act strengthened Medicaid tremendously by modernizing it and promoting program integrity. The ACA also helped America's most vulnerable. Thanks just to the law's Medicaid expansion, more than 12 million people gained insurance coverage. So in short, let me say this. If you want to strengthen Medicaid, if you really want to strengthen Medicaid, strengthen the Affordable Care Act. Thank you, Mr. Chairman. I yield back the balance of my time.
Chair thanks the gentleman. Gentleman yields back. The chair recognizes the gentlelady from Indiana. Ms. Brooks, 5 minutes for questions, please.
Thank you, Mr. Chairman. I'd actually like to talk about something that we've done in Indiana that my colleague from Indiana's talked about, which I do believe will strengthen Medicaid, and that is Healthy Plan 2.0, Healthy Indiana Plan 2.0, which I might say the logo is Health Coverage Equal Peace of Mind. So we in Indiana do believe that health coverage